Hello and welcome to the Talk with Tariro. On the program today, we are looking at one campaign that's being rolled out in our country, a campaign which is running under the tag hashtag 72. To unpack that particular issue on the program, I have Florida Rumbidzai Mapeto. She is a communications officer with Adult Rep Clinic. Welcome to the talk, Rundi.
Thank you for having me, Tari.
Yes, I want you to start off by unpacking for us when we are talking about hashtag 72. What is this 72 and why is it so important?
Okay, so the hashtag 72 campaign was basically formed around issues to do with the emergency period survivors are asked to come or visit their nearest health facility after they've been raped. So the time when we started the campaign, we're also realizing some trends that the majority of survivors that we had seen since inception in 2009 had in fact not come to the clinic within 72 hours, which is worrying because this is a service that is free and accessible. And most of them were saying that they didn't know about this, or rather they just thought they needed to go to the police first before they come to get the service.
You're talking about people used to think that after rape you needed to go to the police. I actually remember having an episode where I know it's some years back, but people were actually talking about if you go to the clinic, they'll say bring a police report. Has that changed now?
That has changed actually, because the constitution doesn't actually say survivors of rape must first bring a police report before they can access services, because like I said, this is an emergency.
How do you deal with I know it might sound like a silly question, but it's things that people grapple with on a day-to-day basis. The issue of now tampering with the evidence, how is that dealt with? Where I've rushed to a clinic to seek services, and sometimes in the process, I'm actually destroying the evidence that would assist in this person being convicted, the abuser.
Okay, so that 72-hour period as well, the nurses will tell you that this is the time where evidence can still be collected, because we do the forensic medical examination. So in there we get swabs and whatever we can still extract from the survivor's body, any physical evidence that is there. So this is when we tell a survivor that when you've been raped, don't bath, don't take a shower. At least within 72 hours, you would have accessed your service, and then every procedure that is needed, even for the court processes, would have been extracted.
I know you have tried to unpack it, but when you are looking at the importance of this campaign and really unpacking more in terms of the consequences of late reporting, yes, you are talking about the evidence would be tampered with, and I'm already thinking when you're saying within 72 hours, don't bath, that's how many days? 3 days.
3 days.
So don't change anything on you as a person. Just emphasize that, unpack that for us, really for people to understand why this 72 hours is very important.
Okay, so there are physical, mental, psychological effects of rape. So this 72-hour period centers mostly on the physical. So that's what I'm going to focus on. You know, if a person is raped, the assumption is, or most times, these perpetrators are very careless. So they might not have used protection, which means that the survivor is being exposed to STIs or unwanted pregnancies. The
HIV.
medications that are used for this are, they're supposed to work within 72 hours. So you have your post-exposure prophylaxis and then the emergency contraceptive pill, which can be used to up to 5 days, but 72 hours is the time that each is most effective. So we encourage survivors to come in for that. And then there's also HIV. And we give this treatment within 72 hours because normal consequences are true kutaura. You don't want a survivor to show up 5 days later when they could have been saved, or some will come after maybe 10 years and the only reason they are now reporting is because something emanated from that rape. Now they are HIV positive, or now they have an STI, and then they're saying it could have happened that time when I was raped by an uncle.
Yeah.
But if they had managed to come to the clinic within 72 hours, these effects would have been avoided. So those are some of the number one consequences when it comes to the emergency treatment that we'll be talking about.
Um, uh, you know, Rumbi, you're talking about how important it is to access the services. When rape has happened to me, sometimes psychologically, I'm really affected. It becomes a major challenge. Yet you are actually emphasizing how it benefits me as a survivor to actually seek the services. In the event that the abuser is actually with me, I know I'm supposed to go to the clinic in 72 hours, but the circumstances are not allowing me to access the services. What happens?
Okay, so there's still I think right now, because COVID-19 has exposed us to a different kind of emergency that we didn't think would happen maybe 5 years ago. No one anticipated that people would be asked to be in isolation. And isolation is a environment that abusers use a lot. So we've tried to use different strategies. Even when a survivor contacts us, we then ask, are you able to talk? And there's ways that survivors just communicate within the system, and also with nurse counselors to say, okay, this is what's going on. So these strategies, the survivor can call and say, this is what's happening to me, but my husband is only out for a few hours, so I can't do it. Maybe he's the perpetrator or my uncle. Then we arrange on a case-to-case basis that, okay, so which area is closest to you? If we can't be there, then we arrange with the next VFU officer or somebody that is closer to where the survivor is, so that we get help to them instead of them coming to the clinic or being caught in the process of trying to get a service. So I know it's not as easy, but there are ways and strategies that we can come up with and that we've seen working with survivors as well.
Well, that's Rumbi there, really emphasizing the importance of reporting rape within 72 hours. She has unpacked the benefits, why it is important for us to have rape cases and presenting ourselves, if we are survivors, within a health institution within 72 hours. We will continue with this discussion after the break. We are continuing with our discussion, and today we are focusing on the importance of reporting rape within 72 hours. I want to find out from you, with the current emergency situation, how has it affected survivors in accessing 72 hours within that particular period that you are talking about?
Okay, so what we've realized is survivors, again, that issue of this whole topic of sexual violence and sex, they don't feel comfortable just disclosing it to anybody. So you'd find survivors calling and saying, okay, I'm still within 72 hours, but when I get to the roadblock, what do I say? Because I think what you've seen physically, it's very few survivors that show that there's something going on or something happened to this person. So they might not be able to have something that is considered an essential service in terms of what they are seeking. So uri kurwara here, but hapana one parikuradza kuti uri kurwara. Someone might even be energetic.
Yeah.
And for some survivors, like you were saying, if a person is locked down with their perpetrator already, how do they just say how do you just wake up and say you're going to the hospital? It's those challenges right now that have been introduced to us by this whole COVID-19 situation. And some strategies, the survivors themselves, you ask them, so what do you think? How best do you think you can do it? Do you have a way that you can leave the house?
Yeah.
Some would then say, I think I'll just go to my neighbor's house. I'm going to get something there. Then I'll ask my neighbor if they can find a way to bring me to you guys. So it's very difficult, I won't lie.
Would you say you have success stories where you would say with people reporting within 72 hours, yes, we've managed to reduce some unwanted pregnancies in such and such a way. We've managed to have people getting post-exposure prophylaxis. We haven't had recorded STI or new HIV infections from this. For us to then say, yes, this is a campaign that's effective, that's working. You know, people always,
Yeah,
yeah.
people want evidence.
Yes.
Actually, yes, since this whole campaign started, we've seen an increase on a monthly basis of survivors who are presenting within 72 hours. So, which means that the information is
It's
getting
getting
out
there.
there, and we've been conducting trainings with other stakeholders and service providers in the victim friendly system. So, they're able to just know if a survivor comes in, the moment they say they're still within 72 hours, they have to go and get medical treatment. So I think we also need to then appreciate that the moment that a survivor comes into the clinic, we have what is called a baseline of their previous state before they presented. So if you come into the clinic, we know if you're not HIV positive already, then we give you enough counseling and information about taking the post-exposure prophylaxis. And I think it's been a 90 or 100%, according
Yeah.
to our data, 100% success rate of the 72-hour period.
So when I've reported within 72 hours, I've presented myself to you, what are the services that you offer me? Maybe walk with us stage by stage. What happens there?
Okay, from the moment a survivor comes into the corridor of Ward C9 at Parirengatwa ARC, they get into the waiting room, and then the nurse counselor welcomes them into our reception. From then, we do what is called an intake. This is where we get to know the survivor. Who are they? Where do they come from? And then from then we get to know the circumstances. That's when we find out when did this happen. Then from that door, they walk into the counseling room where they receive counseling and psychosocial support. This is where they also give consent for the next procedure. Would you want to have a medical examination? And also, this is what happens with the medications that we're going to give you based on your history that we saw, and just to make them comfortable in
Yeah.
the space. And by this time, they have already received counseling, so they are in a safe space. We've also established a relationship with them based on what they have prevented to us. So all the crying, the screaming, the punching would have happened.
Yeah.
And then we go to the examination room. Now that's when we do whether it's a pregnancy test, because we want to know.
Yeah.
Some say because the survivor is a survivor, it doesn't mean that they were existing in
Yeah.
isolation.
Exactly.
A survivor could have been pregnant before they got raped. So we also want to know those things. After they do the medical examination and forensic examination where the evidence is collected, they go back to the counseling room now, and then they're given their medications with some form of light counseling about what to expect after taking the medications. And then we discharge them, but they have a 7-day review period that they come back to the clinic, and we see how they're doing with the medications and if they have any concerns still, since taking the medication. And then we follow up. So we follow up a survivor up to about 6 months before they're discharged. And for very traumatized survivors, they can still come even over the years, because some relapse and they still need, those things are now coming back. So we've got a psychological department that specifically works with these very traumatized survivors. So these are the services that we offer, clinical services that we offer from the moment a survivor walks in.
Well, we are hearing the different services that we can actually access when we present ourselves within 72 hours. We know we are in a period where we have COVID-19, our movements are restricted. And when we are talking about accessing the services within 72 hours, yes, we might face challenges here and there. But from what Rumbi has said, if we inform the police at a roadblock to say I'm visiting a health facility, we already know according to the regulations, you can actually allowed to pass. If you're having any challenges, we can actually make calls. But it's important that we present ourselves at the nearest health facility whenever you've been sexually abused, whenever you've been raped, to report that and to access the necessary medical services, which will protect you from any STIs, unwanted pregnancies, HIV infections, and any other negative things that could just happen to you as an individual. We'll continue after the break. Welcome back. Our discussion continues, and we are looking at the importance of reporting rape, sexual assault within 72 hours. We heard about the different services that one would access when they report and the associated benefits. Rumbi, what I want to find out from you is if I do not report within 72 hours, can I still access services afterwards, say after 2 weeks?
Okay, so yes, survivors can actually receive services even if they didn't present within 72 hours. Right now, because we're trying to observe the social distancing regulations,
Yeah.
we are trying to reduce as much traffic as possible at the clinic. So we're taking in emergency cases that present within 72 hours. But those that did not will still access services via phone or other virtual platforms that are comfortable to them. And
What's the difference in terms of the services that I would then access now within, say, like if I come after 2 hours as opposed to when I present within those 72 hours?
Okay, so if you haven't if you present within 72 hours, you're still eligible for the emergency treatment and the medical examination. But if you present later on, the time period for these medications has passed already. So there's not, it limits the services that we can now offer you. So mainly we're now looking at the reason why you've presented yourself. Probably you need legal services, or you probably need shelter from the, we refer you to our partners, Musasa Zwala. And then if you just need counseling and psychotherapy, then our counselors and our psychologists are there to offer you that service. But as for the emergency treatment aspect of it, we can no longer offer you that because the time period has already passed.
Okay. So looking at the stigma that is just attached to rape, and having someone opening up, getting the courage to then say, I'm leaving home, I'm going to a health facility to access services. Yes, you are talking about it's important to access these services within 72 hours. And already we know survivors would be grappling, battling with the stigma that is just attached to rape. How do we balance the two?
Okay, this whole campaign, the hashtag 72, the reason why it's termed in a way that it doesn't just immediately scream or rape, it says something else, it starts a conversation. We're also trying to create that sense of urgency on the survivor's part that my health matters even though I've been violated. So everything else may follow afterwards, but you can only then get that voice if you manage to seek services. So the stigma exists, but you can always become empowered enough. You can have your voice after you've been given the services. So when we go out into communities and talk about this, we are now calling rape a medical emergency instead of calling it something else. You know, just to bring out that stigma. And they are not well, whether it's physically or mentally. So let's get them help. Let's not judge. Let's not be quick to talk about things that don't factor into the health of the survivor. So in a way, it's a campaign that just goes through breaking barriers of the conversation around sexual violence, so that instead of people talking about the sex aspect of it, they also concentrate on the health
Yeah.
aspect of it.
Yeah.
Yeah.
I actually like the fact that when people are looking at this particular issue, you are emphasizing the importance of looking at the health side of things, the health benefits. And in the event that I can't come to you, where can I access services? I know your offices are here in Harare. I'm in Wange. Where can I access these services that you are talking about within the stipulated time, the recommended 72 hours?
Okay, thanks, Tari. I'm actually glad to say this, that we are now available in Kadoma, Gokwe, and Mashingo. So survivors can now access services in those sites that we are now functioning in. But again, the message does not just limit to ARC. The Ministry of Health and Childcare has said it over and over again, and this model exists, that a survivor should not be turned away for presenting at any nearest health facility closest to them where they are, and they just go there, get an post SGBV services. So whether you are in Wange, there is a general hospital or a clinic in Wange where you can get services there. If it must be that you have to come to ACT, then you can, but that should not limit you. It's a matter of just looking for your nearest health facility and say, ministry yakati ndinofanirwa kuuya pano kana ndabatwa chibharo. It's when we really follow up to what the government or our ministries say about our health and what services what is this, are rightfully ours if we've been violated. So it's there, the service exists. And I think right now the models that we have also taken, we're doing these campaigns even in areas that we are not. We go to Mazowe, we go to Goromonzi. Our kids not there, but we're just raising awareness, and we even visit local clinics there and find out what are the challenges, are people coming in. So services are there where you are.
And finally, your message to Zimbabweans.
I think my message to Zimbabweans is that we need to start changing the conversation around rape and sexual violence. This is something that the moment we start putting it under the carpet and saying "Azvitaurwe," we are destroying future generations. So let's stop trying to solve this internally, inyaya yemumba, because unfortunately the consequences are dzinyaya dzemumba. Pachazvarwa mwana, zvirwere zvinobuda out of that. So let's encourage each other to seek services within 72 hours. These are free services. There is nothing stopping you from accessing them. And remember, your health matters and every hour counts.
Well, that's all we had for you on the program today. Your health matters. Every hour counts. If you've been raped, you've been sexually abused, make sure you report within 72 hours so that you can access the necessary emergency health services. Until we meet again next week, it's goodbye.